media violence and how it affects our youth, teen depression is on the rise, and vacation weight gain. This is Carolina's Healthcare System Network News. Media violence and violent behavior in our youth. Is there a link? According to some experts, there is.
Evidence about media violence effects on kids is overwhelming. The most recent evidence has to do with violent video games. We know that, for example, kids who play a lot of violent video games become more physically aggressive. That is, they become more likely to get into fights at school. Playing a violent video game for 20 minutes, for example, increases aggressive thinking, and that increase in aggressive thinking leads to later more aggressive behavior.
Media violence and the role it plays in influencing violent behavior in our youth was the focus of the 11th Annual Youth Violence Prevention Conference recently, sponsored by Carolina's Healthcare System.
There's 50 years of research that says that violent media has negative impacts on our kids, and it's going to take a tremendous amount of effort and will from our parents and from our educators to really try and combat all the millions of dollars that are put into the entertainment industry.
I work with elementary students, and unfortunately, I see more and more violence and aggressive behavior all the time, and kids talking about like video games that they play and videos that they watch on the internet.
TV is it's showing more violence now than they showed years ago. And so we have to be cognizant of how it does affect our children.
There's a number of things that we can do, but all of them require that the parents sort of recognize that this is a problem and be willing to invest time and effort into having discussions with their kids about what the significance of the problem is.
The rate of young people suffering from depression is on the rise. According to a report, youth who have had major depression are at greater risk for suicide. In fact, the rate for those between the ages of 12 and 17 who have experienced depression has increased from 9% in 2004 to 11% in 2013.
Some of it has to do with genetics, some of it has to do with life circumstances, stressors, trauma, where they live, whether they feel safe, exposure to violence in the home, school failure.
And while the numbers of youth experiencing major depression is going up, those receiving treatment has gone down from 40% in 2004 to 38% in 2013.
One thing that can affect treatment is access to care, and there are so many factors that affect that, including insurance credentialing, time of visits, and mental health stigma, as well as access to a provider who will write prescriptions for medications if that's indicated. And if you're asking about whether adolescents are being screened for depression appropriately and frequently enough at routine care visits, probably not in line with the recommendations of the Academy of Pediatrics.
And how should parents keep themselves and their teens less stressed?
I think that it's very important to have routine care. And I also think that if parents have a concern, they should act on it. If they are having difficulty with communicating with their teens, they should act on that as well.
Beware the vacation. It could lead to weight gain and contribute to creeping obesity. In fact, a week's vacation could leave many adults with extra weight that can hang on even 6 weeks after the vacation is over. In a study, 122 adults between the ages of 18 and 65 took vacations from 1 to 3 weeks. The result? 61% of them gained weight, the average being over half a pound, but some of them actually gained as much as 7 pounds, while others actually lost a few. The study authors noted that despite the slight increase in physical activity during the vacation, the participants increased their caloric intake, especially from alcohol consumption, an average of 8 drinks per week before vacation to 16 drinks during vacation, accounting for a significant increase in calories. But the good news here is that the vacationer showed reduced stress levels and blood pressure. But how you reconcile the reduced stress and blood pressure with the weight gain is yet to be determined. So the takeaway? Take that vacation, but go easy on what you eat and drink.